Now, two factors which will decide definitely how much intrusion has taken place. That is a very important factor. Okay. The second important factor is the age of the patient. Third important factor is your root development. So let's start with the root development. Okay, root development. So here one option is root development is complete. Okay, one option. Or I would say, okay, let's discuss. Root development is not complete. Let's let that be, or incomplete. The second option is root development is complete. Okay. Now, why is it important? If the root development is not complete, the chances of spontaneous eruption, what is happening? Intrusive flexation. The chances of your tooth to spontaneously come out, erupt, increases. That is why one factor, root development, because it is on a growing phase, good blood supply it is getting, and it can easily have a regeneration and have a re-eruption into the normal space. So regeneration is more. Now, younger the patient, understandably, younger the patient, again, the chances of spontaneous re-eruption is high. Okay, so again, that is the second factor. So let's consider the second factor, which is age. Okay, age, yeah. The root is not developed. What will be the usual age of the patient? Especially when it comes to your incisors and all. Incisors or premolars, usually the age of the patient is 6 to 11 years. That is where after 11 years, especially for your anterior teeth, the root development is almost getting closer to completion. Majorly, we are taking here the anteriors because the trauma, when a child falls, the most common area of trauma is your anterior, isn't it? So 6 to 11 years will be the age. Okay. Now, as I've told you, root development is a very important factor. Age was a very important factor for your spontaneous regeneration. And as I've told you, how much it has displays is another very important factor. So I'll just bring it down here. Okay. Now, the book says, very important, this is a question has come. Up to 7 mm, you can expect spontaneous eruption. Definitely, most of the time it will erupt, especially if the age of the child is 6 to 11 years and the root is not developed. It will come up. But now the problem is, if it is greater than 7 millimeter of intrusion, spontaneous eruption is a question mark. It might erupt. Still, you can expect because the child is younger age and your root development is not complete. So it's still the fine. But now there's a possibility that it will not spontaneously erupt. In that case, you have to go for surgical extrusion or orthodontic extrusion. Now you can see here a surgical is preferred. Why? It is quick. Surgical extrusion is quick. So the more the tooth is intruded, isn't it? So it has gone inside into the intraoral environment. And most of the time, what happens? Something which was exposed outside is going inside. There's a chance of infection being spread inside there. So you have to, at the fastest, you have to take it out. Second thing is osteoclastic activity. The tooth is inside, osteoclast can be activated and can resorb the teeth. So you have to take it outside at the earliest. So you prefer surgical. Now, it's a high-end question, and at least you have to remember root development, age, 7 mm. That's the key. Up to 7 mm, it will re-erupt. Okay. Now we said there's another possibility where your root development is complete. Then the chances of spontaneous eruption is very low, or I would say low, and it is going to be very low if the age is greater than 17 years. So that means your age is a very important factor here. So that's what I'm going to put it here now. I'll take it down. Okay. Yeah, I'll take it here. That will be better. So two possibilities, isn't it? Two possibilities here. Okay, age 12 to 17, that is 11 to 6 to 11 is already there, the root development phase. Okay, after 12, the root is development is complete. So you take it here. And the second is greater than 17. Okay, now in this case, again, use some other color. When it is 12 to 17, again, it's a young age, isn't it? Still young age. Here, 17, definitely you have to go for surgical or whatever be the displacement, 7 or less than 7, whatever, you have to go for surgical or orthodontic. Okay, because that age, greater than 17, it will not spontaneously erupt most of the time. But 12 to 17, still there's a possibility if it is 7 mm or less than 7 mm, up to 7 mm. Still there is a possibility remaining. And greater than 7 mm, again you have to rear up. But then up to 7 mm, still there's a possibility, but comparatively lower than this. Okay, lower than the case where root development is not complete. Okay, so what are the factors there? Major thing is the root development. Okay, and how much has it erupted? Sorry, how much has it intruded? Up to 7 mm, it is safe, especially in a very young age. Okay, so major thing you have to keep in your mind is if you have a case, please note, if you have a case where the root development is not complete and less than 7 mm, if the question comes, you have to wait. Other than that, everything, waiting is a question mark. Okay, waiting is a question mark. Okay, so many a times examiner will be asking you this. Okay, underdeveloped root, 4 mm, 5 mm, 6 mm, 7 mm. Okay, and this is all they're talking about the permanent teeth. When it comes to your primary teeth, the situation is slightly different. Slightly different. Okay, so yeah, permanent is fine. So what did we see? How much? Can you give me a break of 2 minutes? I'll come back in 2 minutes. Just quickly revise what did I say so that you understand the primary better, because primary is also based on a little bit complication. It's all about intrusive luxation. You've got lots of questions. So what we are saying is, in case of your permanent teeth, if your amount of intrusion is less than 7 mm, you are on the safer side. And especially when it's a root development is not complete. Okay, when your root development is not complete. When it comes to your primary teeth, what is a primary or what is a major criteria? Your tooth germ itself. Okay, your tooth germ has to be. If it is hitting, if there is any danger of being hitting on the tooth germ, you have to remove it. Okay, so but there's a safe margin. This is a safe margin which your book says if it is greater than 4 mm, it is not at all safe. The intrusion of your tooth germ, if it is greater than 4 mm, go for extraction undoubtedly. Go for extraction undoubtedly. Now, so the second option comes there. What is that? If it is less than 4 mm. If it is less than 4 mm. So you can expect spontaneous eruption. Okay, you can expect spontaneous eruption. Okay, that's the key. Now, your angulation is important. It has intruded 4 mm. Okay, straight. Or I would say greater than 4 mm straight. You have to extract it. Less than 4 mm straight. You can retain there. But then, do you think your tooth germ is going to go straight into the depth? It can have some angulations. So it's very important, very important. You take a radiograph. Okay, you take a radiograph and confirm so that you know how it has gone inside. Okay, so now you take the radiograph, you see that there is a foreshortening in the radiograph. Okay, then, okay, or I would say, in simple terms, okay, before going on to foreshortening, if it has gone inside, if it is, closer towards the tooth germ, you have to extract it. If it has gone like this, okay, if you intrude it, if it has gone like this, apex has gone on the opposite direction, it's fine. How do you decide on a radiograph? That's the key. Okay, so that is where I was talking about foreshortening and all. Okay, so now if the tooth is showing foreshortening, means to say that you might have seen when you take your angulation of the teeth, you see your canine very small. That's called foreshortening, very small canine. So if you see that it is looking very small, foreshortened, what does it mean? It is towards X-ray cone. Means to say that it is laying like this. You have just taken the X-ray like this and it is laying like this, then only it will become shortened. Foreshortening, that is the apex is towards the cone, the apex of the tooth. You have to learn this, there is no other option. Now you will learn about all these angulations, everything in radiology. When does it foreshorten? When does it elongate? Don't worry. Next subject is coming. But then as of now, it's always better to just by heart. If it is towards, the apex is towards the X-ray cone coming from here, then you will see it foreshortened. That is the apex towards, you have to learn there's no other option, okay, towards the cone. Okay, apex is towards the cone. There is, what does it say? What does it mean? Apex is towards the cone. Is there a danger or not? Is it dangerous? Apex is towards the cone. Is there a danger involved here? Yes or no? Yes, no danger. So if you see foreshortening in the X-ray, there is no danger. Now, on the other side, the problem is if you have an elongated, okay, if you have an elongated, okay, this is away. So you see elongated, okay, away from the X-ray cone. It shows that the apex is away from the X-ray cone and there is a danger. You have to go for extraction. I'll show you one question. Is there? Yeah, fine. Let's see this question. Okay. So yeah, simple terms, if there is elongated, there is a danger and you have to remove it. Okay. Another, when it comes to primary, greater than 4 mm, definitely extract. Okay. And then go for radiographic examination as well to confirm it, if there is a danger or not. Okay. Whereas permanent, we said it's all about how much your tooth root has developed and how much intrusion has taken place. Okay, 7 mm was there. Here it is 4 mm, remember. Let's see this question. In a 3-year-old child, the maxillary incisor, so 3-year-old child,